Hey guys, this is Dr. Hub. Today let's look at the diaphragmatic openings. So under diaphragmatic openings, let's look at the T8. So T8, it is located, where is it located? It is located in the central tendon. So the location will be the central tendon. Now let's look at the structures which are passing. The structures which are passing, it includes the IVC. IVC means the inferior vena cava as well as the right phrenic nerve. So both of them, they are from the T8, that is the inferior vena cava and the right phrenic nerve. Now let's look at the T10. So what does the T10 include? So if you look at T10, it includes the presence of the esophagus. So T10, it includes the esophagus as well as the vagus nerve. The vagus nerve, we have the right and the left vagus nerve. Next we look at the T12. So what does the T12 include? The T12, so before going ahead with this, we need to know that the T10, the location is in the muscular part. Location of the T10 was in the muscular part. Now we'll be learning about the T12. The T12 is the location. So what is the location of the T12? The location of the T12 is nothing but in the crus of the diaphragm. It is in the crus of the diaphragm. And what are the structures which are passing through it? The structures passing through, it includes the aorta. The structures, it includes the aorta. There is also presence of the thoracic duct, that is a TD. Then there is also presence of the azygous vein as well as the presence of the hemiazygous vein. Hemiazygous vein. So there is the aorta, thoracic duct, there is azygous vein and the hemiazygous vein. So T12 in number it is high. So similarly the structures passing are also the highest compared to the T8 and the T10. Now let's look at some minor openings of the diaphragm. So minor openings of the diaphragm. So what does it include? So there is something known as the space of Larry. So the space of the Larry. So what does the space of Larry include? The space of Larry is nothing but there is a costoxiphoid. It is a costoxiphoid gap. And that includes the superior epigastric artery. There is the superior epigastric. There is a superior epigastric artery. Next is the medial arcuate ligament. So medial arcuate ligament is nothing but we are writing it as MAL, and this is concerned with the sympathetic chain. There is a sympathetic chain. Next we have the lateral arcuate ligament. There is something known as a lateral arcuate ligament. So lateral arcuate ligament, it is concerned with the subcostal nerves and vessels. It is concerned with the subcostal nerves as well as the vessels.